My name is Dr. Stephen Fox, and I'm a family physician, and I have a special interest in lifestyle medicine. We're very excited to be offering this weight loss program called Healthy Weight, Healthy You at UT Family Medicine. This is for any patient at our practice, but you do have to be an established patient to be able to get this preventative service. I've been practicing now for 13 years, and there's a large percentage of the people that we see that are wanting advice on how to become healthier, and more specifically, how to lose weight. And so I've gotten together with a local dietitian named Dorothea Sarli, who worked together with some other group projects, and we've tried to put together a great program that helps people be informed about how to change their health behaviors, their diet, how to exercise, sleep recommendations, to try to help them achieve their individual goals. To qualify for this program that we're putting on, you have to have a body mass index greater than 30. And that can be calculated just by knowing your height and your weight. And the reason that that is a requirement is because this is a preventative service that we're offering. And so if you have a BMI greater than 30, you can come and participate in this group visit with no copay. We have me as the head physician. We have a dietitian named Dorothea Sarli. We have a nutritionist. We have health coaches. We have clinical pharmacists. And we have some other employees within the Erlanger system who are going to be helping us keep people engaged, share information, share resources. We have decided to try to summarize as much information as we can into 6 sessions that'll be held with groups of 15 to 20 people all at the same time. And each session will be 90 minutes. That 90 minutes, we're going to include some evidence-based lectures that are quite small to share the information with people. But it's also going to include food samples that will be catered. There's going to be cooking demonstrations that are live, and everyone will get their own notebook, and there'll be time to set very specific goals that are individual to each participant. And then we're hoping beyond just obesity to address any other chronic medical condition, just like we would in a typical visit. So in light of trying to make people healthier, we're hoping that we're going to be able to de-escalate or stop medication or lower the dose of medicine as people come back to these sessions week after week, and that's going to be actively monitored. And if you need routine blood work or preventative services, we'll offer that just like we do in any other visit. Everybody who enters the class will get their own notebook. That notebook is going to start out with their first sheet that sort of just tries to explore, why are you here? What are you going after? And that's going to be foundational for the rest of the class. We're going to keep coming back to that. Why are you doing this? Because that's the underlying motivation behind everything that we do. But each class, we're going to be setting goals, and we have specific small bite goals that we're going to be trying to expand with each session. That's going to give you the ability to track all of your progress and your behaviors over time, which has been shown to improve sticking with habit change. We're also going to include recipes that we're sharing. The food samples that we bring and the live cooking demonstrations, you're going to get all of those recipes. So you're going to leave with a 3-ring binder that has all that information, and we'll keep adding to it week after week. So in between classes, we will also be reaching out to patients electronically through MyChart, which is our electronic medical record system way of communicating sort of via email. And those messages are going to include things like recipes, words of encouragement. There might be resources like websites to visit, movies to watch, books to read, and they'll also receive a personal phone call from one of our CPC Plus employees to go over their goals and see what's going well, if they hit any obstacles, and maybe what they could learn from that. Because we have built such a big team around this and trying to deliver such high quality care, we are asking for patients who sign up to commit to paying $60 for all 6 classes, so that comes down to $10 per class. And we're hoping that that cost will be offset by not having the copay.